Cosmetic upper and lower eyelid surgery, or blepharoplasty, is among the most popular of cosmetic surgeries performed by a wide range of surgeons. What's frequently underappreciated is the delicate structures that are critical for proper eyelid function. This means that eyelid surgery doesn't only affect appearance, but also has an effect on your eye's health and potentially your vision. After completing my residency in ophthalmology, I received specialized training in oculofacial plastic surgery. I focused a significant part of my practice for helping people with complications from eyelid surgery for more than 30 years. The most common issues I see affecting the lower eyelids, for example, is when a lot of plastic surgeons will perform fat grafting in an effort to improve volume under the eyes, which is understandable because a lot of hollowing occurs with normal aging. In my opinion, the tear trough area and the eyelid skin has little room for unpredictable and irreversible results. I see people from around the world who have lumps and irregularities from fat grafting needing surgery for removal. Since fat grafting is performed in a way where the fatty tissue ends up in multiple levels, every patient's surgery for revision has to be customized, factoring in the potential compromise in lower eyelid position and stability. As a side note, I personally prefer using hyaluronic acid fillers placed at the deeper levels with cannulas, as the results are more predictable and reversible with hyaluronidase rather than surgery. Another common complication that occurs with lower eyelid surgery for under-eye bags is lower eyelid retraction. Lower eyelid retraction means that the lower eyelid is lower than where it was before surgery, resulting in more of the white part of the eyes showing. Not only does the original character of the eye shape change, but the lower eyelid function to provide optimal tear film distribution on the surface of the eye is compromised. Lower eyelid retraction is most frequently associated with the technique called transcutaneous blepharoplasty, which is the most widely practiced among general plastic surgeons. This procedure is performed through incisions in the lower eyelid skin and through the underlying muscles to access the herniated fat pockets. Routinely, there's also the removal of eyelid skin with the intention of improving wrinkles. For many people, this approach can compromise the lower eyelid anatomy, resulting in loss of support and descent of the eyelid margin. Additionally, skin removal can cause a skin shortage, where the eyelid is pulled away from the eye in a condition called ectropion, as well as eyelid retraction. At times, this can result in eye exposure with irritation while sleeping because the eyes don't close completely. The strategy for revision surgery after lower eyelid surgery complication is essentially to restore the anatomy that has been compromised. Procedures include restoring the stable attachment of the eyelid to the bone structure and of placement of grafts such as dermocellular matrix in order to restore support inside the eyelid. When there is significant skin loss, particularly if the eyelid is displaced away from the eye, skin graft may be necessary. My preferred technique for cosmetic lower eyelid surgery is the transconjunctival approach, where I address the herniated fat pockets from the inside of the eyelids. There are no skin incisions, and the anatomy supporting the eyelid remains fully intact. I typically address wrinkles non-surgically with lasers, radiofrequency, platelet-rich plasma, or PRP, to improve the quality of the lower eyelid skin. As far as upper eyelid surgery is concerned, there are some infrequent occasions when too much skin is removed requiring a skin graft. A more common cause of upper eyelid surgery dissatisfaction is treating drooping eyelids only by removing upper eyelid skin. Drooping eyelids, where the eyelid margin is low and makes you look tired, is not just due to upper eyelid skin excess, but in actuality the stretching or detachment of the muscle that lifts the upper eyelid, called the levator muscle. This condition is called eyelid ptosis. Eyelid ptosis most often is due to age-related changes of the levator muscle, which is the muscle responsible for opening your eyes. This means that if eyelid skin is removed, but the muscle is left untreated, the eyelid will still look droopy with the possibility of having a skin shortage. For these patients, I would perform ptosis correction surgery and skin graft if needed. The take-home message is that a proper evaluation and planning with appropriate performance of surgery can minimize the risk of eyelid surgery complications.